we have heard Emily speak on the interesting topics of drunk driving laws and her loving mother. We have also learned that she is abnormally close with her family and loves to spend a lot of time with them. And she is a very kind and loving person. Emily became interested in Raynaud's disease because her grandma actually has had it since Emily was a little girl. Ladies and gentlemen, please welcome Emily Milchak.
About 1 in 20 people in the United States develop Raynaud's disease, as stated by NIAMS.gov, copyrighted in 2013. Raynaud's disease is a disorder that affects blood vessels, mostly in the fingers, generally not in the thumb, and in your toes. The disease is mostly common in women. We will be exploring several facts about Raynaud's. We'll start with symptoms, move into the 2 different types, and ending with treatments of the disease. First, we will be going through the symptoms of Raynaud's. As stated by WebMD.com, updated in 2013, the affected area becomes white, blue, and then red. It becomes white as the blood supply is reduced, blue as the oxygen supply in the area decreases, and red as the blood returns to the area, which usually causes a burning, throbbing sensation. They do not always occur in the same order for all people all the time, nor do these 3 stages always occur in a given attack. Cold fingers and toes is another common symptom of Raynaud's. Occasionally, the disease only affects 1 or 2 fingers or toes. Living in cold climates is typically not a good idea for someone who is unfortunate enough to have Raynaud's disease. In rare and more severe occasions, Raynaud's can also affect other parts of the body, such as the nose, ears, and lips. The final symptom we'll be going through is a numb and prickly feeling that occurs in the affected area. This happens when the blood supply is temporarily limited. Also, when the blood supply is dramatically narrowed, a warm, stinging pain occurs, typically due to stress. Next, we will be going over the 2 different types of Raynaud's. According to Raynaud'sDisease.htm, copyrighted in 2013, a website that specializes in health conditions, it is important to distinguish between primary and secondary forms of Raynaud's disorder. The first type is primary Raynaud's phenomenon, which is often called Raynaud's disease. It is the mildest and most common form, and the majority of people with this form of Raynaud's don't experience a secondary disease as a result. The cause of primary Raynaud's disease is unknown. The other type of Raynaud's disease is secondary Raynaud's phenomenon. It can be caused by related health problems. Common health problems that occur with secondary Raynaud's are carpal tunnel syndrome, lupus, scleroderma, mixed consecutive tissue disease, in which blood vessel walls thicken and constrict too much, limiting the blood flow. Finally, we will be going over the different types of treatment for Raynaud's. As stated by MayoClinic.com, copyrighted in 2013, dressing in layers is usually pretty effective when treating Raynaud's disease. Wearing gloves is important if the affected area is in the hands, and wearing socks is important if the affected area is in the feet. In more severe forms of the disease, medicines are used as a treatment. Calcium blockers are common when treating the disease. These drugs relax and open up small blood vessels in your hands and feet, as stated by MedicineNet.com, copyrighted in 2013. Another medicine that is commonly prescribed by doctors is vasodilators. A vasodilator is a drug that relaxes the blood vessels. Sometimes in cases of severe Raynaud's, opposed to using medicines as a treatment, surgery is an option. For surgery to occur, the disease has to be very severe. The surgery may work for a little amount of time, and then the disease will come in effect again. In rare cases, the surgery works completely. According to NHLBI.NIH.gov, copyrighted in 2013. Raynaud's is a both fascinating and complex disease, and anyone who is unfortunate enough to get it has to be exceptionally strong. Exploring through the symptoms, types, and treatments of Raynaud's hopefully helped you understand this commonly unknown disease. You should always appreciate the small things in life because you never realize how important they are until you lose them. As stated by my grandma Lynn, who has a severe case of Raynaud's disease.